started then. Thank you very much for this invitation to speak with you. It's a real honor, and I look forward to exploring with you whether the pieces of advice I'm going to offer today are actually helpful in your workplace context. And I'm pleased that we'll have some time for discussion at the end of the presentation to do so. Today, I'm going to be sharing tips for getting started in medical education research based on my own experience of getting started and also my experience of supporting others to get started in medical education research. At LEEDS, I lead our intercalated medical education degree, supporting undergraduate students to take their first steps in research. And I also supervise master's and PhD students who are coming to medical education research for the first time. On this slide, you can see one of my undergraduates giving his first medical education research presentation at a conference. And I think his face sums up just how rewarding getting started in medical education research can be. There we go. Okay, so to introduce this topic, I decided to use this fuzzy picture of my colleagues at LEEDS to highlight a key message I want you to take away from this presentation. Medical education research is best undertaken in collaboration. The traditional view of the researcher is a very individual one, and we tend to think of the researcher as striving for individual acclaim. However, I strongly believe that medical education research benefits from the coming together of different perspectives and different people from different backgrounds coming together. Most people who enter medical education come from another disciplinary tradition. In this picture, you can see practicing clinicians, staff from other healthcare professions, computer scientists, a laboratory scientist, statisticians, and someone who came to medical education research through her experience of being a carer. So for most of us, entering medical education research involves a transition, and that's a transition to new ways of thinking and carrying out research. Educational research can be a little different to our previous research experience that we bring from other disciplines. Educational research is applied in the sense that it seeks to understand, inform, or improve the practice of education. Educational research is critical in the sense that we're often questioning the way things have always been done in medical education. It's systematic, so it's deliberate, careful, thought through, and as I'm going to go on to talk about in this presentation, it's driven by specific research questions which give the research its focus. Educational research is also transparent. So our aims, our methods, and our arguments need to be explained fully. And researchers often share their own background and their beliefs and consider the ways that those influence their research findings and interpretations. In educational research, claims are substantiated by evidence, and we also aim to use theory in our work. Educational theory helps us to make sense of our findings, or we could be looking to build or to test educational theory. And another important feature of educational research is that it aims to be original. Now, that doesn't necessarily mean that you need to come up with a completely new topic, but your research should be adding to existing knowledge in some way. So in this presentation today, I'm going to outline 4 key early steps to developing meaningful research, which can achieve that educational impact that we're striving for in educational research. So my first step is to identify a worthwhile research topic. And I have some questions on this slide to help you to do that. So how do you come up with a meaningful and a worthwhile topic? Well, I think it helps to think about what you're interested in, and what you're passionate about, something that you find really engaging and interesting. You could also think about what you're concerned about. So the parts of educational practice that you're struggling with, or something that you worry about in terms of the direction of medical education. It's also important to see what other people are worried about and what other people are currently talking about. What are the hot topics in medical education of the time? And so you might look to media, to healthcare staff, to medical educators, to researchers, to students, to find out what are other people grappling with, and what do other people want to know. An important step that I'm sure you're familiar with is looking at what's already known. So looking to the academic literature to see what previous researchers and previous authors have written about that topic. Okay, so here's an example from my own research. And this is the study that arguably Anne-Marie and I are best known for, about developing final year undergraduate clinical placements. And this study came out of widespread concerns from academics, from clinicians, from graduates, from the media and the public about newly graduated doctors' preparedness for practice. So on the right-hand side of this slide, you can see a newspaper article. So normally every August, we have the same news story come out about it being the first day that the newly qualified doctors are going to be practicing, and that you're at greater risk. Try to avoid A&E. Interestingly, I didn't see so much of this story this year with the COVID-19 pandemic at its height. But certainly year on year, we do see this same news story and this same concern about graduates' preparedness for practice. So much of the previous research around preparedness had laid blame on individual doctors for not being prepared, or for medical schools and not sufficiently preparing doctors for practice. However, we knew from our previous research that doctors' practice was highly dependent on the particular workplace setting. We therefore sought to find out how clinical teams could further support students to understand and develop their local practices, to develop those context-specific practices. And we developed collaborative methods working with clinical teams to understand how students could take on a more active role in the specific workplace environment where they were placed. And so this is an example of identifying an educational problem and seeking to enhance clinical placement learning. So looking to have that applied function, making that educational impact. But I do offer a word of caution here. What you identify as the problem may not be seen as a problem by others. And I see this often in my supervision of undergraduate medical students. Often they come to me wanting to research an aspect of the curriculum that they think is lacking, or that they don't feel is addressed sufficiently. So some examples in our setting are research teaching, or pharmacology teaching, or social prescribing teaching. And the reason that they have these beliefs is because they don't necessarily understand the challenges of curriculum design yet. And they don't necessarily appreciate that an undergraduate curriculum can't cover every single topic in loads of detail. Or it may be just a case that they're too early in their undergraduate training and they don't realize that that topic is studied in greater depth later in the curriculum. It's very important for my students to talk to members of the medical course team who can explain the rationale behind curriculum decisions and steer students towards much more pressing questions. At our institution, it's also a requirement that any research projects involving medical students receive permission from the course lead to go ahead. So it is very helpful to bring the course lead on board early in the research, because if there are problems with the research project, it's better to rectify them early than to go to all the effort of making an ethical application and then finding out it's not suitable. So this brings me to my next key step in getting started in medical education research, and that is engaging stakeholders to help you. So who is a stakeholder? A stakeholder is somebody who's interested in your research topic or is likely to be affected by your research findings, or somebody who has the power to actually get your research findings into practice and to be implementing your recommendations. So some key questions to ask when thinking about who your stakeholders are. Who else is doing the research? Which other researchers are interested in this topic? Who is asking you to do the research? So who is looking for the findings from this project? Who might be interested in the subject of the research? Who is affected by the research outcomes? And importantly, who might be involved in acting on the research findings? So who has the power to achieve change based on your research? And there are lots of different ways that stakeholders can help you to develop a meaningful and worthwhile project. They can help you to understand your research topic and to identify relevant research questions. They can help you to discover whether your research design and data collection methods are actually possible and acceptable. So they can give you advice about which data collection method might work best. Should you be using an interview or a focus group or administering a survey? What sorts of questions you should have in those tools? Whether any of those questions might be sensitive for the group you're looking to recruit as research participants. They can give you advice about how best to recruit participants, because we all need participants in our studies. And so finding out the best way of doing that is really helpful. Stakeholders can also help you to understand what your audiences need and how best to communicate with audiences. So the people that you want to be making change and implementing your recommendations, they may not be the sorts of people who read academic journals or go to medical education conferences. So engaging those people early on can give you a feel for how you might communicate your findings. Are there key meetings that you could go along to and present your work at? Would a 1 or 2 page summary of the study be helpful? So that can be very helpful to know right from the start of the project, so you know how you're actually going to get those study findings into practice. For my students, I think there's also an element of gaining valuable skills and experience. So through working with stakeholders, they gain skills in communication, presentation, negotiation, those sorts of things. And most importantly, involving stakeholders increases the prospects of your research being applied in practice. So if you're engaging others in your research and the emerging findings, it's much more likely that you can achieve change. Okay, so my example here is the research project which brought me to LEEDS in the first place and was my first medical education research project. And in this project, I was interviewing staff and students from 3 different healthcare professional courses. So at the time I was doing this study, I was not only new to medical education, but also nursing training and audiology training were foreign to me as well. So in order to undertake these interviews effectively and to gather rich data from students and staff, I needed to understand what was expected of students in these different clinical environments and different clinical roles, and how best to get in touch with staff and students to encourage them to participate in my project. So building relationships with the course leads for each of those programs, for medicine, for nursing and audiology, was really, really key to gaining this understanding and also for gaining access to the research participants. So these are just a couple of ways that stakeholders were helpful to me in that particular project. But you can be engaging stakeholders at any stage of the research process. You might want to engage them early when developing your research topic and your research questions. They can be really helpful, as I say, when designing your data collection methods and figuring out what's going to work best. Increasingly, we're seeing stakeholders involved in actually collecting the data and analysing the data. And a really important time is in reporting the findings. As I say, getting stakeholders to help you in getting the findings out there and getting those research findings into practice. Okay, so we're now up to step 3. So 3 of 4 steps I'm going to cover in this presentation. And that's a very important step. This is thinking carefully about your research question. In educational research, research questions are really very important. They drive all other aspects of a research study. They give your research project focus, and you come back to them time and time again when you're trying to make decisions about what you're going to do next in your project. So they are very key. And they don't tend to come quickly. So in my experience, there's a period of working and reworking and rephrasing your research question until you get it to a point where it can really influence those decisions and drive the research project in the way I've just said. So I really like this quote that I can't see particularly well in my display, but I think it says the selection of innovative and valuable research questions, it's not a single act. It requires considerable effort, uncertainty, and intuition. And so again, this is a step that I think really benefits from talking things through with others, working with supervisors, working with mentors and so forth, because it does take time. There are some tools that can help. So a previous colleague of mine, Vicky Ward, introduced me to this acronym FINER. And this acronym lists some of the considerations when developing a research question. And these are, is the research question feasible? Can it be done with the resources that are available? And most of us who do medical education research do so with limited resources. We're trying to do it in amongst many other demands. We mightn't have very much funding to do the research. So we really need to think very carefully about what's actually possible within the limited time and resources that we have. Another aspect is interesting. We've talked about this before. Do you have passion for it? Will others be interested in it? A research question should be novel. Is it a new research idea? Does it add to current knowledge? Ethical? Can the study be done in a way that does not pose excessive risk? I'm not going to be talking too much about ethics today, but there are some lovely papers about how about the sorts of ethical considerations you have when you're doing research on your own students. Anne-Marie is one of the authors of one of those papers, so I really encourage you to follow that up if that's of interest. And the last aspect of the FINER acronym is your research question relevant? Does it pass the so what test? So we quite often talk about the so what in medical education. And what the so what is, is this research going to make a difference? Is it going to have an impact on educational policy and practice? Is it actually addressing an important problem that people are tackling? So that's also an important consideration when developing your research question. This checklist can also be helpful, and this is something I share with my students. So this asks 5 different questions. Is the question right for me? Will the question hold my interest? Can I manage any potential biases or subjectivities I may have? So sometimes it can be very difficult to do a project if you are too close to the research topic, because it can be quite difficult for you to see the issues from other perspectives. So again, I think if you are very close to a research topic, I think that's where having colleagues to help you and to offer alternative interpretations can be very helpful. Is the question right for the field? Will the findings be considered important? By who? Will it make a contribution? Is the question well articulated? So in this early phase of a research project, I think there's a period of time where you're working out what language, what terms do people use when entering this territory? And your research question needs to be clear and clear to others. So defining some of those key terms can be really helpful. And I'm going to go on to talk a minute about unchecked assumptions and avoiding unchecked assumptions and keeping yourself open to different interpretations. Well, we've already talked about feasibility, but is the question doable? Can information be collected in an attempt to answer the question? Do I have the skills and expertise necessary to access this information? If not, can the skills be developed? Or can I bring somebody else in to help me? Will I be able to get it all done within my time constraints? What resources will I need? Are there any potential ethics problems? And a final question is, does the question get the tick of approval from those in the know? Does my supervisor think I am on the right track? And do other stakeholders or experts in the field think that my question is relevant or important or doable? So the example I'm going to share here is one from one of my undergraduate students. And she came to me with an interest in undertaking research about health inequalities teaching. And this was very much due to her belief that there wasn't enough teaching about how to treat patients who are most disadvantaged in society. So she started with a very simple question that was grounded in this assumption and her own beliefs. Is there enough health inequalities teaching in the core undergraduate medical curriculum? And this was quite a difficult question to answer in a year-long research project and would probably require a longer follow-up study. So it wasn't necessarily the most feasible question to be asking in a year-long research project. And my feedback to the student was, it wasn't a particularly well-developed question because it leads to a simple yes or no answer rather than exploring this topic in greater detail and depth. She then went on to talk to stakeholders, so teachers involved in the health inequalities teaching within our medical curriculum. And through talking to those involved in this teaching, she discovered that there was health inequalities teaching in the undergraduate medical curriculum, but it just wasn't necessarily recognized by students. And they suggested that perhaps the question was how more students could be engaged in this teaching and how teaching could become more powerful or more transformative for these students. So this led the student to go on to study a particular cohort of students who were very passionate about reducing health inequalities and had chosen to undertake elective health inequalities related projects. And this led her to develop a much richer set of research questions that lent themselves to more detailed qualitative exploration. So she asked, what motivates second and third year medical students to choose projects which address health inequalities? What do students expect to learn from health inequalities teaching? And to what extent are their experiences realized? And what can be learned from health inequalities projects which can enhance the core undergraduate medical curriculum? So again, that final question really leading to some sort of recommendations and to some educational impact. Okay, so I'm up to my final step now, which is step 4, and that's seek out mentors who are more experienced in medical education research and to collaborate with peers. And this is something that has been very valuable to me throughout my own career. Medical education benefits from bringing in multiple perspectives. On this slide, I have some pictures of some of my collaborators and some of my mentors. So on the right-hand side, you can see Anne-Marie Reid and Claire Morris, whose theoretical expertise was really valuable for our Change Laboratory project. So they have particular expertise in an educational theory called activity theory, and we were able to put that to work very effectively in our research project. On the left-hand side there, you can see an evaluation of a study about 360-degree videos in medical education. And this project would not have been possible or would not have been as useful had we not employed Vanya Dimitrova as an additional supervisor in this project. So Vanya brought from computer science methodological expertise that was very helpful for evaluating those videos for education. And in the middle, you can see some colleagues of mine from the Netherlands and from Germany who are helping me to understand how cultural context shapes undergraduate medical education. But really my final point to you is that the medical education community, the international medical education community, is a very friendly one. And I've always found that when I've gone to others for help and support and have been unsure about next steps, there's always been someone to help. And I think people are very keen to help and to foster excellent medical education research. So I really encourage you to reach out to others. So this brings me to my final slide and my take-home messages for getting started in medical education research. And these are really these 4 steps that I've mentioned throughout the presentation. Firstly, identify research topics that address educational problems. Secondly, stakeholders can help you to produce worthwhile research. Talk to people about your research ideas, and they'll really help you to understand your topic in greater depth and to be making those decisions about what's going to lead to a very worthwhile project. Research questions are very important. Again, talking to others can help. And also there are checklists and guides out there in the literature that can be very helpful for developing research questions. But the ultimate tip for getting started is work with others who can help you to develop your understanding of educational theory and research methods. So I really look forward to a conversation with you now about getting started in medical education research and hearing from you whether these tips resonate with you in your workplaces and in your practice. So I'm going to stop sharing my slides now and put you back in the hands of Dr. Tabassum.
Yes, sorry. You want to go for the Q&A?
Yes, so let's go to the Q&A, please.
Yeah, so the first question that's coming in is related to ethics of research on students. So the comment that is made is if you can elaborate more on this area.
Right, I think that's a really good question for Anne-Marie to answer. And I want, because she has written in this territory, so I'm wondering whether Anne-Marie would like to come on there.
Yes, of course. Thank you, Alison. We've done quite a lot of research involving students, and I think the first questions are always around getting consent from them, explaining to people exactly what's involved and getting them to volunteer. And of course, if you are a member of staff, a senior member of staff, and you're asking students normally through email if they'd like to take part in research, you don't want them to feel under pressure. There's a power dynamic, so you don't want them to feel as though if they don't take part, it's going to affect their assessment outcomes, or if they do take part in some way, that's going to influence them. So that's one of the sort of basic areas. And also some of the work we've done has involved observing students on placement as part of the research, and that often brings in other issues then. If you see something that just because you were there in your research capacity, if you see something that's perhaps unprofessional in that placement, it can bring in a role conflict then. I'm here as a researcher, I'm not here as a clinician or an academic member of staff in that sense. But of course, for us, there would still be a duty to escalate that problem to someone, to say, I've seen something and I'm concerned it might be unprofessional. So sometimes it brings in issues around consent, around power, around these different role conflicts, and that's often an issue. And the paper I wrote with some clinical colleagues was very much around that. The 2 clinical colleagues who'd been doctors in different settings, one a surgeon and one a doctor, but they were carrying out research in a researcher capacity, which meant their role was quite different, but they still had some of their own professional responsibilities if they observed problems or if a patient was in difficulty. But I'm sure Alison would like to add some of her experience as well to that.
Yes, so I think that those issues of emphasizing voluntary participation are really important, and also escalating if you identify a risk to patients. I think they're very important. I would say that most of the projects I have been involved in have been relatively low risk ethically compared to other sorts of research. But occasionally my students have shown an interest in studying aspects such as mental health or well-being of students, or sometimes tricky assessment questions or questions around cheating, which perhaps are a little bit more sensitive. And we've needed to put protocols in place for where to direct research participants to further support if they need it. So you're directing them to talk to their personal tutors if they have any issues, or using the university counselling service, for example, or going to those responsible for assessment if they have any worries about assessment. It's when I'm working with my undergraduate students as researchers, I think it's very important for them to understand that it's not their role to solve their research participants' problems, that they should be referring their research participants on to others who are experienced to give that support.
Okay, thank you. The next question is related to problems faced in medical education research publication. So the question is how this can be addressed within the framework of the local problem, because as you say that the research must be related to the local problem, I should be addressing as well the local problem, not only in terms of the international problem. So how will this be addressed? Because researchers, and publications do look into the generalizability of the research.
I think that's a really good question, Dr. Tabassum. And I think you can address that in multiple ways. I really acknowledge that publication is very competitive. It's something that I experienced myself. It is difficult to get published. And quite often in educational research, we are doing research in our own context. And I think that there are, and there is, and a lot of the research that we do in educational research, it's not necessarily aiming to be generalizable, but to understand our case and understand our context better. So I think there are a couple of ways you can address this. I think one way is to be making much more of a methodological or a theoretical argument. So developing theories and methodologies in medical education that can be employed by others, and that's certainly something that Anne-Marie and I've done in our change laboratory work, is to be developing methodologies and adapting them for use in medical education. But also, I think there's great scope for collaboration. Again, that was another of the themes of my presentation today, joining up with people in other countries and contexts to compare experiences. And often through comparison, you actually learn a lot more about your own place through that comparison. So on my last slide, I had a picture of some of my colleagues who I met through IMEX, which is an international medical exchange program. And so we're currently doing a study looking at medical students' expectations of what their life is going to be like as a doctor. And through looking at it in each of our contexts and comparing experiences, we're noticing different things and the uniqueness of where we are, which I think is really helpful. So I think there are a couple of tips. So maybe aiming more for the theoretical or the methodological contribution, or collaborating with others and looking at to what degree your experiences are valuable for others.
Yeah, right. Thank you. I think that's a wonderful suggestion. There are more questions that are coming in. So we also have questions related to ethical aspects which should be looked into while doing medical education research. So I guess you did have mentioned this, but if you can elaborate more to respond to the question.
I didn't quite catch that, Dr. Tabassum. Something about ethics?
Yes, ethical aspect. How should it be looked when doing a medical education research?
how should it be looked at? How do you start in thinking about the ethical issues?
Yeah, probably the question that is being posed by the by one of the participants is related to, you know, what are the things that you keep in mind when you are considering a medical education research? Is it related to subject? Is it related to, you know, data, or is it related to even if you are doing some CAP survey? So probably it's related to that.
Yes, yeah. So I think the ethical considerations, they're all about weighing up the benefits of the study versus the risks of the study. So when you're considering the ethical issues, it's about considering, is there any risk to your participants? Could they come to any harm from this project? Can you come to any harm as the researcher through this project? And maybe even you might want to consider, is this research project going to lead to any harm for my institution? So they're key things to be thinking about. So often when we do research, we cause somebody to think about something they may have never thought about or never taken the time to think about before. I don't think we can always think of research as being completely benign and not having an impact on people. So I think you need to consider, is it going to be harmful for people to be sharing their experiences? And do the benefits of the research outweigh that possible risk of harm? Again, this is an area where stakeholders can be really helpful, actually. So you can talk to the groups that you're likely to be recruiting from, to talk to them about, do you see any potential risk in this study? Is there anything that I'm proposing that would worry you? Piloting your survey or piloting your interview questions with stakeholders, again, can be really helpful. Yes, and we've already referred to some of the other ethical issues you might want to consider around power relationships and whether participants may feel an obligation to participate rather than the participation being voluntary. And also considering, if you're doing research in clinical contexts or with people who are responsible for delivering care, is anything likely to emerge that you're worried about as a researcher in terms of patient care? So hopefully that helps to answer that question, Dr. Tabassum, some various issues you might want to consider.
Yeah, it does. And I think there's one more related question. So I'm going to connect it with your response. And it talks about the research data that has been collected in this digital age. So how do you think, and what are your viewpoints? And because, the point is that nowadays the data has been collected to systems report. So what are your points on this aspect?
Do you mean, Dr. Tabassum, the sort of the storage concerns and?
Yes, I
Yes.
see. It seems like the question is been asking related to this.
Yes, yeah. So at the moment, where I am in Leeds, all research is being done remotely, educational research, and we're using approved university platforms for that. So it's a requirement of our local ethics committee that you do use platforms that are encrypted and secure, and that you're storing data in on the university systems, which are all password protected. So I tend to recommend that my students use the university systems rather than more global systems. So we're not, some of our students have wanted to use more things like Zoom and that sort of thing, but we tend to guide them to use our approved university systems because we're much more in control of those.
Right. So there are a couple of questions which are, related to medical education research and adult learners. One question says that medical education research is evolving in adult learners and healthcare delivery nowadays. So what are the challenges related to adult learners in medical education research?
do you mean undertaking research with adult learners as research
Yes.
participants?
Yes.
And moving more into the postgraduate territory?
Yes. Yes. Yeah, it appears like that. Yeah.
Yes, yeah. I think one of the biggest challenges in undertaking research in the postgraduate space is recruitment. And particularly at the current time where everybody is very, very busy, and the workload and the issues that people are dealing with are very demanding. So I have some PhD students at the moment who are undertaking research with, one's undertaking research with surgeons, and the other is undertaking research with physiotherapists. And I think they're finding recruitment and organizing interviews a lot harder at the current time. So I think that's probably one of the biggest challenges that I would say. But you know, aside from that, I think many of the issues of undertaking research with undergraduate students are quite similar in the postgraduate territory as well.
Right. So the question is now related to the introduction of medical ethics or medical research curriculum in undergraduate medical education. So what do you think is the best time to introduce this in the undergraduate medical education curriculum?
Oh, thank you very much for that question. That's one of the things I'm most passionate about. And I have been, my own students have been doing research about research teaching in the undergraduate medical curriculum. At LEEDS, we have research all the way through our undergraduate curriculum. So our students start in year one and they continue doing research all the way through. So in the early years, there's very much a focus on the more sort of clinical, experimental research, and they're introduced to critical thinking and literature search skills and those sorts of things, and then they go on to develop clinical audits, and they do research projects in the final 2 years of their undergraduate degree. So it's a bit more, I guess, a bit more theoretical in the first couple of years, and then they go on to practice their research skills in the final 2 years. And I think it's really important for students to be introduced to research skills early, because I think that they don't only learn how to do research, but they also learn to think more critically, to question what they read, to be able to use evidence in their clinical practice. I think that is really key, and perhaps the most important outcome actually from an undergraduate research training is to be able to use evidence and to use literature to inform your practice. I have some in medical education research, we not only do quantitative research, but we also do qualitative research. And a lot of the students who come onto my intercalated medical education program have had very little experience of qualitative research. And what they say to me is, after having that year of training, they wish there was more of that in the core undergraduate medical curriculum, that they would like to engage much more in qualitative research in those early years of the medical curriculum, so that they're aware of the full range of possibilities of research, and that perhaps research involving people is more accessible for some students. And students have said to me that they can see more greater impact of that sort of research. So so I think that's an interesting area that we're considering at LEEDS, is incorporating a little bit more qualitative research in our undergraduate medical curriculum. I'm not sure if I've answered the question. I've kind of gone around the houses there, Dr. Tabasa, but hopefully that's helpful.
It's okay. Actually, many questions were related to this, like introducing undergraduate medical education curriculum in research, and where to fit this in the undergraduate curriculum. So I think you have very nicely responded. And the other point that has been made is about if first year students of undergraduate can have an understanding of consent, can this be introduced, can this be given as a lecture, or be introduced, the concept can be introduced to them. So I think you have holistically covered it, but if you want to add something on it,
Yes.
or
I wonder, Anne-Marie, did you want to say anything more about that early research curriculum?
Yes, and I think often the best way to introduce it is to get students to read a research paper, particularly if they choose a research paper in a topic that they are interested in, and then they get some help to try and read that critically. So you get them to look at how the research has been conducted, who's been involved, what kind of methods have been used. And so they start to just recognise, they may not be able to recognise if it's a very good, strong paper or if it's not very well conducted initially, but they start to recognise the kind of questions that you ask to get you to the point where you can tell if this is a good study and therefore are the findings going to be very valid. And of course, then you can introduce them as well to thoughts around, well, where was this paper published? Was it published in a journal which was a peer-reviewed journal? So we know there's been some quality assurance. Was it something they found in Google that someone had uploaded themselves? And that doesn't mean it isn't a good paper, but it just hasn't been through the same process. Is it something that's just about an opinion piece rather than actually a piece of research conducted? So I think early on you can get them just to try and start to read papers and begin to ask those questions, and then link the kind of lecture teaching to that. So you pick out the questions and relate it to the concepts that Alison's been describing, like what is a good research question, who are you going to involve when you're designing the research, how are you going to conduct it, and then you gradually introduce them to ethical issues as well. And I think both of us are very passionate about this, but I think we would both admit that it isn't easy either. And in order to get students excited about it, you've got to find out what's of interest to them and then take them through it gradually and reassure them as well that the language of research is a field of study in its own right, so they're not going to learn overnight. It's going to be a continual process.
I'd be interested to hear a little bit more about how research figures in your curriculum. Dr. Tabassum, are you in a position to comment?
yeah, I can give an example of what we have in Aga Khan University, because I am placed in Aga Khan University and I work there as an assistant professor. So what we have in the undergraduate medical education curriculum at Aga Khan University is it runs as a longitudinal theme. Students are being introduced, as Dr. Anne-Marie said, that they are introduced to how to, look at the paper and basically identify what are the problems and the gaps in this area and how it can be, written. So they just walk through, and they are then given, projects, small projects as they progress in the curriculum within their progression of clinical years. So they are given smaller projects to work on with, the research faculty, so that they have an idea and they develop small research projects. And by the end of the final year, when they come in, they are able to, write up and do some research, and then they later publish their researches along with clinical faculty or educational faculty, but that has to be supervised.
Mm.
So
And
this is how.
do students tend to be very interested in research?
Yes, because at our university, students are supposed to get involved in this area, because there is another a clerkship that they have to rotate through. So there is a community health clerkship, so they have to do this, and they have to get involved in these kind of projects. So they do kind of develop interest in the areas. So it's it's a longitudinal theme that runs across the years.
Yes, yeah. Yes, as Anne-Marie said, I think something that I find is that I need to spark students' interest in research.
Yeah.
But it doesn't sound like that's as much of a problem there.
Yeah, we need to understand this as well, that spark within the students' interest, and to bring them into the flow and bring them on the same page is absolutely important. Yeah. So coming back to the questions again, people would like to know about your personal experience of how much has medical education research impacted on bringing change.
Oh, yes, that's a really good question. So a lot of our research is very local, as we've been talking about earlier. So the project that I referred to in the presentation, the Change Laboratory project, is where we were actually working very closely with clinical teams to think about how clinical placements could be improved. And it meant for those clinical sites, they made changes to ensure that their students were more actively involved in the practice, and that they weren't seen as a barrier to providing clinical service, but making an important contribution to clinical service. And that practice moved from the clinical teams that we were working with to other hospitals and other areas as well, through sharing of experience and sharing practice. A lot of the undergraduate projects that I supervise, they may not go on to be presented or published, but they inform decisions made in the medical curriculum. So we make a very big effort for the students' medical education projects, the findings to be disseminated to the relevant people teaching the relevant topics within the medical curriculum. So, and we have things like presentation days where staff can come along and see the research, or we make efforts to email summaries of the findings. So our research curriculum is actually undergoing quite a review at the moment. We're developing that strand of the curriculum. So the research that my students have done is actually feeding into decisions being made about the new research strand within our MBCHB curriculum. So we've shared the students' presentations with them, and also met with those stakeholders throughout the process of doing the research to get that research into practice. And that's where those involving your stakeholders right from the beginning is really, really key. So you want to involve the people who have the power to make changes and to make recommendations, to implement those recommendations. So if you have them on board from the very beginning when you're planning your study, I think you've got a much greater chance of making impact.
I was just wondering, Alison, if you wanted to mention some of the research which Trudy and other colleagues have done on assessment in medical education and OSCEs and so on, and how that work was done initially to improve the way we carried that out at LEEDS, but once it was published, it's influenced it internationally as well.
Yeah, we might as well bring Trudy into this. Trudy, would you like to come on and talk about that?
Let me just see if I can, I think, there we go. I'm sitting in my study, but listening to this. I think one of the things, if you remember, Alison, we had, which was our research strategy, and part of that was actually to get people to value medical education research. We decided to take, right at the very beginning, issues within our own school. And at the time, this is some years ago now, when Richard Fuller was with us, we had problems with assessment. So we were not confident that our assessments were as reliable or as valid as they should be. So we took this area in particular and did a lot of work on that. We then worked with other faculty to help improve those. We showed that that had improved our reliability and our validity, and that our stakeholders were really impressed with that, as were the students. And then we began to present those findings outside. So what the strategy was there was to make sure that our own institution really valued the research we were doing, and we got a reputation at home for the work that we did, which was benefited LEEDS and LEEDS students. And that meant that we could go out into conferences and write papers to then disseminate our experience. I think if you don't tell people at home and provide value for people in your own school, then it's much harder in actual fact. And as Alison has already said in her very good presentation, it's getting real world problems, I think, to start off with. Because that's what the Dean wants to know. You know, how can we be sure that our students are competent? That's what the employers want to know. And we worked on that right at the very beginning. So I think that, you know, there's research just to build in knowledge, and I'm not against that, but there's research for application. And I think when you're starting off, particularly if you're a small group in your school, is very much to concentrate on local problems, because that gets you the recognition and support at home for the work that you're doing. Thanks, Alison. That was great. Thanks for bringing me in.
Thank you, Dr. Roberts, for giving us your valuable viewpoints. Dr. Allison, another question is related to publication, and it's related to, because we can see that there are many new researchers who are putting so many questions which are really important to them. And the question that is coming is related to identifying novel topic, and then looking for citations for that particular novel topic. So it seems to be difficult for them. So what are your suggestions on that?
Yeah, so again, as we've highlighted, medical education, it's very multidisciplinary, and it's bringing in perspectives from lots of different disciplines, and sometimes you have to think a little bit more broadly about your research topic to bring in those relevant areas of literature. So it may be that there's something from the field of education more generally, or higher education more generally, that is quite relevant to your research topic. And it might be a case of bringing that into medical education, or it might be a case of bringing in methods that have been used in other disciplines, in psychology, or behavioral science or something. You might be bringing in something from elsewhere that you use in your project. And again, I think once you get starting to talk to others about your research idea, other people will help you to point you in those directions and say, oh, have you thought about this? You could look in this area, you could look in this territory. So I don't think any topic is completely, absolutely new. And I think that there will be somebody who has written about something that's not quite the same, but similar, that you can be bringing in and informing your project.
Yeah, so you have been talking about qualitative research as well. So there's one question that has come in related to action research. So any suggestions how to conduct action research in medical education?
Suggestions for conducting action research? Well, again, I think that's territory where you really need to be engaging stakeholders again. So in order to be conducting action research, I think you need to be working with people to identify what they see as the problems and the areas of their practice that they're struggling with. Because if it's solely your idea, you're not really going to bring people on board for that action research project. So I think, again, I think it's key to be collaborating with others and working with teams to really understand how they see the issues and how they see the problems.
Yeah. So the other question is related to conducting retrospective studies for medical students. So do you think that retrospective studies will eliminate the ethical issues and risks to patients?
Oh, I don't think that eliminates the ethical issues entirely, because you're still using people's data. And I think you have to be very careful about the permissions that were given for that data, what people were told that data was going to be used for. In the UK, we're bound by the General Data Protection Regulations, which are very much about privacy of data and collecting only data for specific purposes and notifying people of those purposes. So for us in the UK, if we were using data like that, it would have needed to have been explained to students that there was a possibility that that data may be used for research purposes. So I don't think you entirely eliminate ethical issues or issues of consent, issues of data protection and storage by doing research that way. I think you still need to think about that data as being provided by people and to consider what permissions they've given for the use of that data.
Yeah. There's one question. I think there's and it's not a question, but it's related to informative or clarification point, which talks about, you know, tools and qualitative analysis. So what are the tools that are available? If you can give a fair amount of idea on this aspect, because I think they are still struggling with how to analyze qualitative data.
Yes, yeah. The authors I most commonly refer people to are Brown and Clark, who are perhaps the most well-known authors of thematic analysis. And they, I can forward on to the team if that is helpful. And they have a website which outlines their approach to thematic analysis, which they called reflexive thematic analysis. And there's also some webinars that are accessible from that website and links to their publications. But I encourage my novice researchers to do thematic analysis because the way Brown and Clark have identified it, it's very stepwise. So there are 6 steps that you follow through. I think it is accessible to people doing qualitative analysis for the first time. And again, you know, I think qualitative analysis is best done in a team. So to pull in people who are more experienced than yourself to talk through your developing findings and interpretations is also helpful. But I was thinking this morning, if it would be helpful to you, I could send to the team a few key resources related to getting started in research, if that would be helpful.
Yeah, that would be wonderful, and we can put it on the website as well for the audience. And yeah, that will be helpful. That will be great. So, few more questions. Again, do you have some collaborative opportunities for research in teaching methods for physiotherapy education?
Oh yes, I'm actually supervising a physiotherapist at the moment. And actually she's doing research around the place of psychology in physiotherapy practice and the degree to which newly qualified physios are thinking about the psychology of what they do. So through that project, we have developed contacts. We don't have a physiotherapy program at the University of Leeds, but there is one at our nearby university, Leeds Beckett University, and we collaborate with them from time to time, and I've certainly developed some more relationships with them through this project that I'm supervising. I think you're muted, Dr. Tabassum.
Oh, sorry, I did right. Okay, so the question is related to nurturing critical thinking skills of the students. How can this be nurtured?
Yes, that's again another really an area that I'm really passionate about. And so the way that I do it on my program is to get well, we go through principles of critical reading, and you know how you know the basics about questioning things that you read and not accepting everything you read at face value and as fact. And the way we tend to get into that on my program is we look at newspaper articles or things that are in the public domain, media pieces that have a very obvious spin to them, so that the students can question the perspectives written in those newspaper pieces, because they're much more willing to critique something that's been written in the media than in an academic paper. So that's often our starting point, that getting into that. And then we do lots of practice. So I ask them to critique a paper. They write a short critique. I write one as well, and we compare them and we look at the different techniques. And so another key thing when teaching critical reading is encouraging the students to go to the literature with a question, something they're looking to find out from their reading, because that really helps you to critique. So, you know, if you're just reading a paper in isolation, it's very hard to know what to be looking for and what to be asking of that paper. But if you go in with a question, so what have previous authors written about problem-based learning? You know, if you have some kind of question that you go into the literature with, that can be really helpful.
Yeah. So now the question is coming is related to COVID-19, which is highlighted the diversity of making medical education and training imparted to DAB doctors at all levels. So any suggestion how this can be addressed by GMC and Royal Colleges, which are now trying to solve this at every level?
So Dr. Tabassum, is that a research question? Is it a question about how we might go about researching or using research to inform the GMC?
Basically, this is involving diversity of medical education and training imparted to the doctors in this era, in this pandemic era.
Yes, I'm not quite sure how that relates to research.
Yeah. So this is particularly, I think it's related to, you know, including diversity, the curriculum. It's not related to research. Yeah. Maybe this can be addressed later when we have another webinar on this area. So we will pick this up and then bring this question again, if feasible, to the attendee who has asked this question. So with this, I think we are done with the question and answer session. Thank you so much. Thank you all of the presenters, Dr. Anne-Marie, Dr. Tree Roberts, also coming in and joining us with your experiences and with your ideas, and you know, excellent and very informative questions which were put in, and more informative answers which were given to us. So I think the audience will be very beneficial with having all these responses from the three experts in medical education. With this, any last comments from Dr. Tree Roberts, Dr. Anne-Marie, and Dr. Ellison from your side, and then we hand over to Shifa.
Just to say, it's been a pleasure.
Absolutely, I completely agree. It's been really good to talk to colleagues who are interested in medical education. It's always a pleasure to do that.
Yeah, I was just going to make a little comment in relation to the last question. Obviously, it's not the main focus of this webinar, but just to say that in LEEDS, as across the UK, we are looking at the way we deliver the curriculum and diversity within it, to make sure that we don't have students from other countries and cultures who feel excluded by it. So, and there's various ways involving making sure we use patient cases that reflect them, making sure, for example, when we're looking at skin conditions, it's skin of different colours, not just white skin. So I think it's a really important point. So I didn't want to let it go completely. And I would be very happy, you know, if to converse with people over email around it if they wanted to talk more about that, because it's very important for us to take into account the views of people internationally, the medical education internationally. But other than that, I'd like to say thank you very much to Alison for an excellent presentation, and to yourselves, Dr. Tabassum and colleagues, for hosting it. It's been a real an honour for us, so thank you very much.
Thank you. It's been a pleasure for us as well. Shifa, it's now over to you.
Yes, thank you so much for this wonderful discussion, and we really, enjoyed it as much as we learned from it. And we hope to have you back again soon for another discussion very soon. I just want to share my screen. Our special colleague, Dr. Cholet, has a webinar coming up. This is on the 16th of December at 8:30 GMT in the morning. And the webinar is Scholarship of Teaching and Learning. So please take a look. I will also post this on our SIVU WhatsApp group. So definitely please take a look. I'll also take the webinar link and share it in our chat. So this is sure to be a good event. And also just an announcement for this time next week, we'll have Dr. Naveed Yusuf, who has a PhD in medical education, who will be speaking on the assessment in medical education. So please keep your ears out for that, and we'll have the poster released soon, and as well as the recording of this event and all others come out very, very soon. So thank you again, everyone, for joining us, and we hope to see you again this time next week.
Thank you, and see you.
Thank you,
Thank
everybody.
Bye.
Goodbye.
Thank you. Goodbye.